Had the speech prepared. Okay, now we're here. We talked to, the sales rep and the application and learning all that stuff. Now we're here with Maureen, who's kind of the scientist behind it all. She's going to get a little bit more scientific for us and teach us what the redox molecule actually does.
Yeah, absolutely. Yeah, happy to. I'm Dr. Maureen Hayes. I'm an anesthesiologist and pain specialist by training, but I teach people about redox signaling molecules because it's a way for people to maintain and attain optimal health. What it does is it works at the cellular level. It helps to detect, protect, repair, or replace in our cells. It boosts up cellular communication so that our cells can actually do their job better. We've also recently found out that it turns on beneficial genes. You've heard a lot about epigenetics. You've heard how lifestyle can turn off beneficial genes, which leads to disease. We found that there are 5 genes that are impacted, and they have to do with things like cardiovascular health, your immune status, your gut health, hormone modulation, inflammation in the body, and immune status. These are 5 things that are important to every living person. So if you go and Google something called mitochondrial dysfunction, because it's all about the mitochondria and the cells, that's where our energy is produced. That's the very reason why we eat the foods that we eat and that we breathe and have to breathe. It's because of the energy that's produced so that every cell in our body can do its job. So when that becomes disrupted in some way, or those little powerhouses, the mitochondria are affected, and they're affected by things like aging, by the medications that we take, by the foods that we eat, by pollutants, whether it's in the air, pesticides, herbicides, all those things that we have all over. And now a really big one is EMFs. So we've been at 4G, we're now going to 5G. This is going to be a very big cell disruptor. So if you Google that, you look and see how your mitochondria are affected and what that may be causing in your body, ask yourself, are you willing to invest in something that's going to help to counteract that, help to boost up those cell signals and make you feel younger, look younger, live younger, and hopefully live longer, a much better quality of life. So that's what this is all about.
Thank you so much. Dr. Herskowitz prescribes this to almost all the patients, and now we understand a little bit better why and how it affects the whole system at a cellular level.
Yeah, it's fantastic and totally non-toxic.
Yeah, and also I just want to say it does have a little bit of a taste, but it's so easy to take. It's so easy to drink or put on your skin. It's really, when you talk about all the supplements and other things we do to stay healthy, I think this is one of the easiest things to...
It's so easy. My family has been on it for 7 years, and we will be on it for the rest of our lives because of the benefits that we get from it. Yes, it does taste a little reminiscent of YMCA pool water, but
it's not pool water. You can get past
it. It's not pool water. It's more like magic water, but there is science behind it. So yeah, thank you, Kim.
Yeah, thank
I'm so
you
happy
for
to be
speaking
able to
with us
share.
today.
Yeah, perfect.